Placenta previa is something you must pay attention to. In this drawing, I'll be showing you how placenta previa, how it comes about and what we mean when we say that a patient has placenta previa and the implications for you and your baby. Let's go. The cervix is the mouth of the womb. So the whole of this place is the cervix, okay? The cervix. Now, this picture is showing a longitudinal section, a pregnant uterus, okay? Longitudinal section. I just cut the womb like this, okay? So what you are seeing here is the cervix. This is what we call the external os. So this is the external os. Here, this opening that you are seeing is called external os. External os. That's the entrance of the womb. Okay. Now this place is called the internal os. Internal os. Okay. Now what you are seeing here is the fetal membrane. Okay, what you are seeing here is the fetal membrane. The fetal membrane. Remember that there is the uterine wall continues like this. So what you are seeing here like this is the fetal membrane. The membrane that houses the baby. This is the fetal head. This one is assumed to be the fetal head of the baby. This is the membrane that covers the baby. So within here, the whole of this place, this membrane, that's where the baby. This is the head of the baby. Okay, this is assumed to be the head of the baby. Okay, so within here is the water that stays with the baby. Okay, the water that stays with the baby. This is the water that stays with the baby. Now, this is the membrane that covers the whole baby. Now, you can see this. This is called the placenta. This is called the placenta. Okay, you can see placenta. All right. Now, this placenta extends from here all the way down to the internal os. You can see it, almost covering the internal os. All right, you can see it almost extending down to the internal os. Now, this condition where the placenta extends down to the internal os or reaches the internal os is called placenta previa. Placenta previa. Now, there is something I will want to tell you about placenta previa. Placenta previa is a dangerous condition in pregnancy, being that you can see that it's very close to the internal os. So, when a woman is pregnant and has placenta previa, if she starts having contraction means that the wall of the uterus will start getting hard. All right. Once she starts having contraction, it will make this placenta. Placenta is just a bag of blood that supplies the baby with nutrients and oxygen. That is what feeds the baby. The baby's circulatory system and the heart and the blood and everything has not started working independently. It still communicates with the mother's circulation through the placenta. All right. So it is the lifeline of the baby. Placenta is the lifeline of the baby. So if anything happens to it, the baby will suffer. All right. Now, in placenta previa, once this placenta is close to the internal os, we say the woman has placenta previa. And placenta previa is known to bleed when a woman starts having contraction of any sort. In fact, occasionally, this bleeding can be unprovoked. She will just start bleeding. It is one of the telltale signs of placenta previa. Unprovoked antepartum hemorrhage, provided the pregnancy has reached 28 weeks and above. We call it antepartum hemorrhage, APH. Provided the pregnancy has reached 28 weeks and above, we call it APH. All right. Now, any contraction, anything at all, that some persons will tell you that they just slept and woke up one day and noticed that they've poured some blood, or that after meeting their husband they will start bleeding, or after anything, bleeding will just start. Think about placenta previa first. Think about abruptio placenta. Abruptio placenta is when this placenta separates from this wall. We say it's abruptio, and it leads to bleeding. Blood just comes out from here, because I said it's a bag of blood. Blood just trickles all the way down and comes out through the vagina. You say that this woman is having antepartum hemorrhage. Antepartum hemorrhage is a dangerous thing in pregnancy. If nothing is done to either deliver the woman or to make sure that the bleeding stops, that woman can die. So if you notice any level of bleeding when you are pregnant, no matter how small, whether it is provoked or unprovoked, please go to the hospital. Make sure you have a hospital where you can easily be attended to, you can quickly be attended to by an obstetrician who knows whether he or she can handle your case or has the capacity to make referrals or has the capacity to invite obstetrician to come and see you. Bleeding placenta previa is a dangerous thing. Just know that in some persons, placenta previa can exist without bleeding, but it's a time bomb. It is a time bomb, okay? Now, what predisposes individual to placenta previa? There are factors that can predispose you to placenta previa that will make your placenta to extend down to the internal os. Number one is multiparity. Multiparity. Okay, you have given birth multiple times. All right, that's number one. Number two, if you have previous history of placenta previa, that means you've had it in your previous pregnancy. You are likely to have it again. Number three is if you have multiple pregnancy. You are carrying twin gestation or triplets or higher. Multiple pregnancy is another factor. Then it is likely to extend all the way down to the internal os. Okay. Now, if you have previous scar, you have done previous surgery in your womb before. Previous scar. It can be previous cesarean section. It can be previous fibroid surgery. Okay. Yes, you can have placenta previa. Now, conditions that can give hypoxia. Hypoxic conditions can lead to placenta previa. Okay, so these are some of the risk factors that can make you to have placenta previa. You can see placenta previa is a major obstetric condition that, if not well taken care of, can lead to significant bleeding that can make the woman to die. Even the baby can as well die. All right, yes, and that is the reason I've said if you have any form of bleeding, whether it is stain and you are pregnant, you must go to the hospital, especially when that pregnancy has passed 3 months, has passed 6 months. All right, let me not go back to bleeding in early pregnancy. Once it is still below, it has passed 6 months, it is time you see your doctor to know what is happening. Okay, to know whether it is placenta previa. You can see what I showed you, placenta previa extending all the way from here. You can see from upper part of the womb back to below the head of the baby. This is the head of the baby, back to below the head of the baby. Then you know you are having placenta previa. It can bleed anytime. All right, so that is what I said. Let me show you. In case you need to see this, you should see it and know exactly what you do for yourself. Thank you. Catch you some other time.